Can the filling you did at the dentist for 300 bucks or more last forever? That's not true. Nothing lasts forever. Same goes to our tooth fillings too. I'm Dr. Scott Lim, your friendly neighborhood dentist. Please hit the like and subscribe button below this video. Your support will motivate me to produce more dental videos, help you and your loved ones having healthier teeth. A tooth filling used to fill up a tooth cavity is made out of an artificial substance. It can eventually fail because it has a limited lifespan. And according to a study, it was calculated that after 5 years of placing the tooth-colored filling, 84% of fillings remain well. A failed filling can cause cavities under it without you realizing, leading to foot stuck and even larger decay to an extent that you can't save the tooth anymore. And here are the 6 signs that you can recognize for yourself if a filling has failed. And if you can identify them, you can be a step earlier to prevent the tooth decay from happening. Number 1 is the filling is cracked. Wear and tear can actually cause your filling to crack, and although this takes years to happen, it can occur sooner if you grind your teeth. And you may ask, how will I know if the filling has a crack? In some cases, you might see a crack in the filling. However, you might not know you have one until you have x-rays during your visit to the dentist. Remember, for any opening in the tooth, even a narrow crack can allow the bacteria to enter in the tooth and cause decay. So it's important to get your filling to be replaced as soon as possible. Number 2 is when your tooth hurts. You have a throbbing toothache where your filling is. It could be possible that your filling has deteriorated and a cavity has developed. If it's left untreated, it may become infected and then require more extensive and expensive dental treatment, such as root canal treatment and procedures after extraction. For example, after extraction, you may need implants, bridges, or dentures to replace the missing teeth for you to chew better. Number 3 is when you may have sensitivity when you drink cold beverages. If your tooth is highly sensitive to hot, cold, or sugary food or drinks, then there may be a crack in or around the filling, even though you're unable to see. And why does sensitivity occur? So a crack in your filling allows the bacteria to invade into the space, exposing the sensitive inner pulp and creating discomfort and sensitivity. Number 4 is when your filling is discolored. Do you have the tooth-colored composite resin fillings? Over time, these tooth-colored fillings can become darker or start to look slightly yellow. Replacing the fillings will restore your tooth appearance and give you a brighter and more beautiful smile. And number 5 is when you were injured. If you starting to blow to the mouth during a fall, sports, or a fight. Not only may you fracture your tooth, but restorations, such as the filling, may become chipped, loosened, or completely dislodged. If you do experience an injury, it's important to visit your dentist as soon as possible. Lastly is when your filling is old. Depending on the type of filling material used, for example amalgam or composite resin, or even GIC, fillings often last between 5 to 15 years. If your filling is old and start to show some signs of wear and tear, it's important to replace it before it cracks. So here are some frequently asked questions by my patients regarding dental fillings.
Doctor, how fast can the decay progress? 1 day, 1 week, 1 month, or 1 year?
The progression of tooth decay is actually quite unpredictable. It differs in the adults and kids' teeth. It takes an average of 2 to 5 years for the decay to travel from the animal, which is the outermost layer of the tooth, into the dentine, which is the second layer of the tooth. And when the decay is in the dentine, the progression rate is double.
Second question is, how do I make my fillings last?
So the white composite fillings can actually last for over many years if they are well looked over by both the dentist and the patient. The following are keys to filling longevity: eating a healthy diet, low in both refined and non-refined sugar, and not snacking. Keeping your mouth clean with regular flossing and brushing, and having regular dental visits for examination and teeth cleaning to help to remove the plaque and calculus that you miss.
And last question is, can I eat after filling?
Unlike amalgam fillings, composite dental fillings actually can allow the patient to eat right after the dental procedure. However, we do recommend the patient only resume eating after the local anesthetic wears off. It can be quite difficult to eat, especially when our lips and mouth are numb. You don't want to run the risk to accidentally bite on your lip, cheek and tongue. While the composite fillings are strong, you should probably opt out of chewing anything which is too crunchy, hard or sticky right after getting the procedure. And that's all for today. Hope the information above helped you in some way. Stay tuned for the next episode. Thank you and see you soon.